This is the podcast to overview the objectives for Chapter 10 in the hospital, which covers the setting of the hospital, procedures that happen in the hospital, and then the effects on patients. So the chapter is going to start out by explaining the history of how hospitals have evolved in the U.S. So way back in the early 1900s, what were hospitals used for? How did we typically see people in hospitals being treated? And then how has that changed over the course of, several decades into what we now see as the role of the hospital? We'll look at the different structure and organization of hospitals, kind of how they're organized in terms of who gets care and where and how that happens. And then as well as the goals of hospitals and healthcare professionals. You'll take a look at the various different types of healthcare professionals, who they are, what their credentials are, what types of settings they would work in, so you can get familiar with all the various layers of healthcare. We'll also look at the purpose of what's called an infection control committee within a hospital. Is a very important committee in every single hospital whose goal it is to prevent the spread of disease, contamination, and illness. We'll look at different changes that have occurred in hospital procedures, such as how things are done, how surgeries are conducted, what happens with the family when kids are going through hospitalization, and just the different aspects that happen whenever a person is hospitalized. This chapter talks a little bit more about communication in looking at hospital staff and their relationships with patients. How do doctors and nurses communicate with their patients? And how do patients communicate with doctors and nurses? What are the nuances of that? It goes over some nonverbal communication stuff there as well. We'll look at depersonalization, which is just something that can happen to patients when they spend time in a hospital, being treated more like an illness or an injury rather than a real person. And then going along with that would be the psychological components of burnout for the medical care professionals. So there's some negative aspects to being in a hospital for patients, not just physically and what they're dealing with in terms of physical limitations and illness, but there's a whole psychological side, and that happens for physicians too. You think about medical care professionals and how much they deal with and what they see on a daily basis really brings trauma and death and one's own vulnerability to mind. So that's something that they struggle with constantly. And so we'll look at challenges that exist for medical professionals in trying to provide treatment to their patients. It's the case that many doctors want to do good, but then they realize their own limitations in that they're not gods, and they can only do so much. Sometimes you can know everything about a particular illness or disease and still go wrong, make errors, misjudgments, or underestimate the illness, or not know what's the right treatment for a patient. Every patient's different, and the body always has the last word. So it can be hard for medical professionals to understand their limitations in that capacity. We'll also look at knowing the difference between a quote-unquote good patient and a quote-unquote bad patient according to medical care professionals. So if I'm a doctor or I'm a nurse, who would I consider to be a good patient and who would I consider to be a bad patient? What are the qualities of each and characteristics? And how might a good patient actually be harmful for the patient. So when I'm a patient and I'm trying to abide by everything the doctor tells me, and I'm trying to, understand my condition, and I do as I'm told, and I don't make a fuss, that's great for the medical care professional, but it can be really harmful for the patient in that they might be missing cues that their body is giving. Patients who have the need to please, especially an authority figure like a physician, might be ignoring their symptoms or ignoring things that are wrong with them because they don't want to bother the doctor or they don't want to look ignorant. They might feel inferior to a doctor, and so they might not speak up and say anything, and that can be harmful. We'll also look at patients' emotional reactions to hospitalization. So when someone's hospitalized, what are the typical responses to that? And what is the coping process like? For anyone who's spent an extended period of time in a hospital, there's definitely some ups and downs in coping with getting through that, in healing and getting better, in treatment. So we'll kind of look at some differences there. Then we'll look at the role of healthcare professionals and how they can help patients in their coping process. And here's really where the health psychologist can play a big role in being sort of the go-between, oftentimes, between patients and medical care professionals, just in helping the patient and the families of patients to cope in the process of what they're going through while hospitalized. And so we'll look at the process then of preparing patients for medical procedures. What are all the various different things that need to happen when a patient's getting ready to have a medical procedure, a surgery, or a treatment? And then we'll look at what that looks like for children. So there's some special issues involved when it deals with the care of a hospitalized children. And children view the experience very differently. Obviously, parents and family play a big role in that. How the parents respond to the treatment or the hospitalization often affect then how the child responds. Children are very naive. They don't understand a lot. This can be good and bad. And so we'll look at the dynamics there that family play, as well as the healthcare professional. And then lastly, looking at sort of how a health psychologist plays a role in the hospital setting. And you'll see a little bit of that throughout the chapter, but more so at the end. And then the tools used to assess medical patients. Tools used to assess medical patients for psychological testing. So sometimes it's the case that a patient's going to undergo a physical procedure, let's say bypass surgery on their heart, or maybe treatment for cancer. And these types of medical procedures can be very taxing on patients. So oftentimes medical care professionals want to assess, are they mentally prepared for this? Are they psychologically okay to handle what's about to come, the next steps in recovery? So we'll look at some different psychological testing that's used in medical settings. And then lastly, looking at terminal illness. What are the various issues surrounding a patient when they become terminal? What are decisions that need to be made by the patient, by the family? How is that typically handled by hospital staff and by family? What are the different roles that those individuals play when it comes to end-of-life care? And that wraps up Chapter 10.